30% of the population suffer with insomnia or poor quality sleep, which can cause problems in their day-to-day life. Poor sleep is associated with an increased risk of developing depression and cardiovascular disease. In addition to the cost to quality of life, sleep disorders cost Australia $14 billion each year, with a further $37 billion in indirect costs. There are several doctor-prescribed treatments and supplements that can help. However, some carry bad side effects and should not be used long-term. With the rise in popularity of natural medicines, the sleep-promoting effects of cannabis are gaining interest. Cannabis contains hundreds of compounds known as cannabinoids. The two best characterized cannabinoids are cannabidiol, which is not intoxicating and has anti-anxiety effects, and tetrahydrocannabinol, which has sedating properties. Although cannabis in its plant form has been used as a sleep aid since ancient times, scientists are still in the dark about the effects of a pharmaceutical-grade formulation on sleep and daytime function in clinician-diagnosed insomnia disorder. To examine this further, we will test the effects of an acute dose of a controlled ratio of cannabinoids thought to promote sleep, ingested as an oil for slow absorption and longer-lasting effects. Using state-of-the-art brain imaging technology, we will answer two important questions. Do cannabinoids improve sleep in poor sleepers? And are there any next-day residual effects on memory, thinking skills, and alertness? In this study, we recruited 20 individuals with moderate severity insomnia. Each participant was screened to make sure they were suitable for the study. They were then asked to monitor their sleep using a wrist-worn activity device and a sleep diary 1 week prior to both sleep studies. Each participant was then randomly assigned to either the cannabinoid drug or placebo. During each sleep study, we examined their sleep, cognition, and alertness over a 24-hour period in a laboratory setting at a sleep clinic. After a washout period, each participant came back to receive the remaining treatment at their second and final sleep study. This study is the first to use high-density EEG to provide novel insights into the mechanism by which cannabinoids influence brain activity. This will allow us to examine and localize differences in the brain's electrical activity during sleep and while awake with much greater precision. The number of approvals for medicinal cannabis prescription are growing exponentially in Australia, despite limited evidence. As the interest in and uptake of medicinal cannabis grows worldwide, so do the many unsubstantiated claims about its effects on sleep. This research is critical to improving our understanding of the role of cannabinoids in treating sleep disorders. These study findings will help inform future research on insomnia treatment and help us find new safe and effective treatments to give a good night's rest to those who need it.